Hello and welcome to Next Phase, where we examine the intersection of technology and healthcare. I'm delighted today to be speaking with Darcy Miller and Kate Manser from Interite, and you are specialists in the design of medical facilities. I'm really keen to dig into that today about what you see as the future of how we need to consider our medical facilities, how we build them for infection control purposes, and culturally, how we might change as a result of COVID in terms of how we even fit out the spaces. Traditional things that we think about, like waiting rooms and some of the workflows and processes within those clinics. Welcome to you both.
Thank you.
And we've had some interesting discussions already because we've worked together, we've opened some clinics together, and I've got to say the clinics are amazing. But they are that traditional model, which is a primary care facility, large waiting room, seating where you'd expect for people to come in and sit in relatively close proximity, maybe using common items like kids' toys or reading material, all of that sort of stuff. Needless to say, some of that changes. What do you think, Darcy? Kate?
Absolutely. I think now is the time to really sort of invest in thinking about the future. Like just as people, we have that amazing ability to adapt to the unknown. And you can see that as like the Australian spirit at the moment is quite strong. You know, we're really fighting through this. And the interior space can also do that. But we've got to, I guess, look at ways in terms of the concept of the fit out, which allows flexibility and adaptability in these spaces.
Yeah, and we're finding that we're having to a lot of people are potentially going to the GP at the moment. They're seeing less chairs in the waiting room.
Yep.
So one way that we're designing around that is also creating partitions between the chairs. So perhaps the use of glazing so that the line of sight is still visible from the reception counter, but then having some glazing with maybe some detail on it or something along those lines where you could still have your seats closer, however, creating that barrier and that sort of thing as well.
Yeah, that makes a lot of sense. Kate, just on that point, are we talking in that instance about retrofitting existing facilities for the new environment? And is that different from how you're conceptualising some of the more greenfield builds about new clinics?
It's a hard one to say. I think it's really a work in progress at the moment that we're sort of getting feedback from the clients and patients about what they need. And then there's also about what's suiting staff as well. So making sure the staff feel comfortable and happy within that space. But I think generally, like Darcy says, we're evolving as this goes, finding out from the start. We're really pretty much getting our brief from the staff as this unfolds week by week in what's happening with that sort of thing. Furnishings are also very important as far as...
Take me through that.
Yeah, so the materials that we're using as well. So potentially we're getting a lot of phone calls at the moment to swap out seating that's been can't be cleaned or wiped down easily. Now Darcy's great. We've got Kryptons that we use. So Krypton is obviously a fabric that's a backing, a plastic backing, but it's also got a fabric sort of effect top so it can easily be washed. Darcy, there was another one, a silver one, isn't there, that you were talking to me about the other day as well. It's got a silver element in it, so it's antibacterial.
So there's actually at the moment polypropylene, which is like your hard plastic chairs. As technologies progress, they've actually created a silver antimicrobial additive, and what that does is it basically stops any bacteria, especially things like E. coli, to grow on this material. So again, it's really easily cleanable as well as it's a solid surface, but at the same time, as designers, we don't really want the space to be completely solid and harsh. Like we still as humans need that comfortability. So it's about really changing our mindset as to, going from solid surfaces to non-porous surfaces, because it's those porous surfaces that are really, I guess, trapping this bacteria and holding onto it. And then that's also, I guess, generating the spread of the bacteria and the virus as well.
So that's a really interesting point. I was envisaging the future of the waiting room where one exists, let's take that scenario, to be a whole series of stark clinical hard chairs with no fabric or accoutrements and the smell of hospital grade disinfectant on the linoleum or the tiled floors. But what you're suggesting is you can actually have some softer design elements that persist that are still infection resistant to an extent.
Absolutely. Like when people go to these spaces, a lot of the time people will hold off going to the GP sometimes because just the anxiety levels for them rise as they enter these spaces because it is very clinical. So moving away from that sort of design of a very clinical space into elements where people are more, I guess, have a resemblance to. So we're seeing a lot of residential type design being implemented into healthcare as a way to reduce that anxiety that people are facing.
That's interesting. Okay. Sorry, Kate, you were going to say?
Yeah, I was going to say, well, the other thing as well that's coming to fruition a bit is that anyone that's got potentially an outside area that can be converted or utilised for waiting is being used at the moment. That then coincides as well with triage, the triage service. So obviously determining prior to the consultation if anyone's at risk. So that's good for the staff and then good for the patients as well. Having that, being able to do that as well so they can wait outside. That is also, when Darcy was talking about anxiety as well, and patients having anxiety, that's also leading into mental health field as well, where mental health patients maybe would be a little bit reluctant to potentially go and see someone. Well, that triage service is now reaching out to people being able to see in their homes, overcoming that little bit of that anxious sort of space that they're in to then take the next step to proceed. So yeah, there's lots of elements coming into play at the moment, which is really interesting.
So there are two things I'd like to pick up on there. One is the indoor-outdoor, and the second is telehealth. Let's take those in turn. So the indoor-outdoor, traditionally we think about the interior, and that's the space that you provide healthcare. But one thing that I've noticed through this, especially where people are reluctant to expose themselves to an infectious situation, whether that's real or perceived, we've seen drive-through flu jabs, we've seen drive-through COVID testing, and potentially that's not just smart from an infection control perspective, that's convenient from a consumer perspective. So you've seen a little bit of that across the network, have you?
For sure. I definitely think with technology helping this situation as well, like telehealth is amazing at what it's doing. It's reaching out to people out in those rural areas that, before couldn't go to their local GP because their local GP was kilometers away. So having technology give that service to people that really need it, especially during these current times, is really rewarding to see.
So I'd love to unpick that telehealth as well. So telehealth is traditionally, okay, I'm in the clinic and I'm providing my usual services. Maybe I'm going to phone in and see some patients remotely. That's one form of telehealth. Given that that's on the rise, are there any changes that are required to how you think about the clinic from a design, build, construct perspective, or is it pretty much par from the course with modern connectivity and computing devices?
Do you want to talk to us?
I was going to let Kate do that one.
One of the things that we are having that is coming across is, as far as the reception counter is concerned, we're being asked to create a 1.5 reception counter. Yep. So rather than having the acrylic screen in between, we're automatically creating that 1.5 so that it's not as hostile, if you like, or not as friendly. Though obviously that's space permitting, because as far as the business model is concerned, maybe that waiting area doesn't allow for that, whereas that could be in another consult. So yeah, that's happening in there as well. And Darcy, with technology as well, there's a bit of technology stuff going on, isn't there?
There is. So I guess in terms of the fit out, the coronavirus is always kind of telling us that, we need to reduce the amount of touching that we're doing. And it's quite interesting, like the previous generations has all been sort of the touch era. And now we can kind of see this potentially phasing out. So we're seeing technology, including with I guess the big guys like Apple and Microsoft, they've sort of invested in doing the close proximity sensors to then allow people to just use hand gestures to then react with a user interface. And although the interior world hasn't quite followed in the exact same way, we are seeing technology like sensor taps, automatic doors as ways to reduce the amount of touching that people are doing in these spaces.
Yeah, that's fascinating. I'm familiar with the concept of edge case design, which is you try and build, I don't know, the classic example is rounded curbs so that people who have accessibility and wheelchair-bound issues can then use it. But then you find these serendipitous knock-on effects where mums with brands go, oh, wow, this is really easy. And then next thing you know, you've got kids with skateboards, and all of a sudden what's good for some becomes good for all. I can imagine going up to a GP clinic and rather than touching that door handle that I know a dozen other people before me have touched today, all of a sudden that's a touchless wave and in through the door. So you're seeing a demand for automatic doors and that sort of stuff too?
Yeah, it's always been
definitely
around, but I guess now more than ever, we've seen that increase happening.
The
Okay.
increase that we've seen it mainly on it is dental as well. So there's a lot of dentists that are, I think, because probably they were the first to feel the hit of this. They're the ones that are really very, very cautious. So we're putting in automatic doors and dental, and they're having, I've seen on a couple that, and this can happen with GPs as well, they'll actually have some tissues outside and inside, and a bin outside and inside, and gel outside and inside. So they can use the gel, they can use the tissue, open the door, and then put it in the bin. So they're not having to touch anything, trying to reduce, and it's only reduce the risk, obviously, as well.
Yeah, that makes sense. I like that idea that you can actually use some of the design elements to funnel some of that traffic rather than having tacky duct tape and X's marked on the floor to indicate how far people should be spaced apart. So already you're starting to see some of that, are you?
Definitely. That's sort of where I said at the very beginning, like that concept stage of a fit out is very crucial to then allow that future proofing to occur instead of having to put on these stickers to tell people to stand where they should be standing. Sometimes being forced to do something can be quite aggressive, even as small as a sticker on the floor. But, there are definitely ways in interior design that we can sort of manipulate people to do the right thing and to flow through the space correctly rather than kind of demanding it.
Yeah, which is nice because it takes the burden of compliance off the staff and also diffuses some of that frustration and aggro that they might otherwise receive. I can see we're coming up on time, but I needed to push on this one because I heard it initially and didn't know what to do. This concept of airflow, especially in an airborne disease process, and what that means for air conditioning and individually zoned consultation rooms, and how do you manage that? Have you had any inquiries to that effect?
We have had some inquiries, haven't we, Darcy? But not so much has been executed. It's more of a curiosity of if this could work. I think potentially probably over in WA, everyone is sort of thinking that, we're potentially out of the woods. So there's been a lot of inquiries at the very beginning of what we can do, but obviously you can put in certain filters into certain air conditioning systems and that sort of thing. If it's pushed through within hospitals, obviously that's something that's pretty essential. Is there value in that? I suppose that's where they're weighing up. Is that something that's worth investing in? Is there another way of solving this? Perhaps via telehealth first of all, and whether that's, do you know what I mean? So it's kind of that that process of working through how relevant it is before they then go and invest in it. Now, obviously, if they were in a high risk situation where they definitely needed an isolation room, where it was going to be committed to highly infectious diseases, then yes, they would say, well, it's a no-brainer. We're going to put that in there. But I don't think, so that's kind of, it hasn't really happened majorly, but it could very much happen, I believe.
Yeah, that makes sense. I mean, we're very much in uncharted waters, aren't we? And
exactly.
I can imagine people would be reluctant to say, let's build for the current climate when things could be very different in another 3 months' time.
Yeah, and people are a bit reluctant to invest in something if they think, well, that could be a huge investment on my part. I don't necessarily know where my business is going right now. I'm a little bit reluctant. How can we solve this without having to go to those different extremes, if that's, if that makes sense? Yeah.
So if we think about what the future looks like, I do think there's going to be some lasting impact as a result of this COVID situation. As your crystal ball, what do you think some of the lasting changes might be?
I definitely say that the waiting area is one area definitely needs looking into. At the moment, we're finding a lot of people are putting off going to their GP because they feel like potentially they're going to catch something going there, or potentially getting sicker leaving the place than when they were entering. So, and I guess that area of concern is the waiting area, because people are finding they're a bit too confined and too close to other people, and they don't know what they've got either. So yeah, it's about thinking, what happens to the waiting area? Does it get larger to allow that distance between each other, or do we look at breaking up that waiting area so that people are, I guess, waiting near their consult rooms, near their doctor's rooms, or near the treatment rooms? And then also, if the waiting area exists in the future, what happens if technology completely takes over and but at the same time, face-to-face interaction, I don't think is ever going to disappear. As humans, we need that connection. So even concepts like cafes, where you kind of have those buzzer systems to then, allow you to leave the practice and then come back, could be an idea. But then as well, you've got the buzzers, which creates another thing for people to touch and share. So maybe that could be introduced through a phone app. So that way you're only touching your own device.
A lot of it's moving that way, isn't it, Darcy, as well? A lot of technology has been removed. So the waiting area itself, all the kids' toys and the magazines, all of those sorts of things have all been removed. The Wi-Fi connection has been made obvious, so patients can connect on the Wi-Fi. It's maybe not as social, but at least they've got their entertainment, whether they're on their phone or wherever they are. They can log in via the phone as well, so that's a way of them checking in. And like Darcy was saying, that's maybe something of the future where there's going to be a buzzer to say that you're ready to be seen, or there's minimising all those contact points as much as possible, I think, is the driver, definitely, on that one.
Well, that's really exciting. And that brings us up to close, because now we're out of time. But I can truly see that the future of general practice and healthcare in general can be significantly digitally enabled and reoriented around the patient experience and safety. So thanks for giving us your times and thoughts and joining us today here on Next Phase.
No worries.
Thank you for having us.
Well,
Thank you.
see you, Kate. See you, Darcy.
Great.
Bye-bye.
Cheers.
Bye.
See you later. Bye.